Good morning, everybody. I am Sasmita Das, Associate Dean of some Nursing College, Sikha Anusandhan deemed to be University. First of all, we are very much thankful to the Nursing Department of State Health Directorate as they have created this opportunity to join with you all. Really, this is a very nice initiation. Today, I am presenting you Triage of COVID-19 patient. Triage is particularly important to separate the patients who are likely to be infected with COVID-19 virus. Triage nursing is very challenging role in today's scenario and very logical approach for the patient management also. ଏହି ସେସନର objective ହେଲା at the end of this session participants will be able to implement various procedures at triage that can be effective at preventing transmissions of virus to the patient and healthcare workers. These are the outlines of the session. First, COVID-19 background, definition of triage, what patients can do before and upon arrival to healthcare facility, what healthcare facilities can do to minimize the risk of infection, healthcare workers can do to protect themselves and their patients, considerations to maintain healthcare delivery as number of COVID-19 cases increases. Let's have a look towards COVID-19 background. As you all know, it is caused by a newly emergent coronavirus, that is SARS-CoV-2. It leads to respiratory tract infections like fever, cough, breathing difficulties, congestion or running nose including pneumonia. It is transmitted mainly via respiratory droplets through sneezing and coughing, and transmission via contaminated surfaces can also occur. If the hand comes in contact with the contaminated surfaces and touch to the mucosa of eye, nose and mouth, then what is triage? Triage is the setting out and classification of patients to determine the priority of need and proper place of treatment. Here, we will assess the patient's severity of illness within short time after their arrival, assign priorities and transfer each patient to the appropriate place for treatment. Patient ର କ'ଣ କରିବା ଉଚିତ? Inform the healthcare provider if they are seeking care for the respiratory symptoms like cough, fever, shortness of breath. Wear a face mask if available while at triage in the healthcare facilities, and during transport, immediately notify the registration desk about the symptoms as soon as they arrive. Wash hands at healthcare facility entrance with soap and water or alcohol-based hand rub. Carry a tissue paper to cover the mouth or nose during coughing or sneezing, and throw the tissue paper in a trash can immediately after use. Maintain social distance by being at least 1 meter away. Healthcare facilities କ'ଣ କରିବା ଉଚିତ? First, set up and equip triage. Set up a respiratory waiting area. Establish triage process. Train the staff on infection prevention and control measures, including personal protective equipment. In setup and equipping triage, place a clear signs towards the registration desk, have a clear sign at the entrance, and immediately report the registration desk in emergency department or at the unit they are seeking care. If possible, arrange the separate registration desk. This is just an example how you will set up and equip a triage. You will have to ensure the availability of face mask and tissue paper at the registration desk as well as nearby the hand hygiene station. A bin with lid should be available at triage where the patients can discard the used tissue paper. Install the physical barriers to limit close contact between the registration desk personnel and the potentially infectious patient. In the context of visual alerts, place these alerts at the entrance of the facility and in the strategic areas like waiting areas or elevators. Alerts should cover the cough etiquette like cover your mouth and nose with a tissue. When you cough or sneeze, put your used tissue in the waste basket. If you don't have a tissue, cough or sneeze into your upper sleeve or elbow, not your hand. put on face mask to protect others, wash hands often with soap and warm water for 20 seconds. If soap and water are not available, use an alcohol-based hand rub. In set of a respiratory waiting area, healthcare facilities should designate a separate, well-ventilated area where the patients at high risk for COVID-19 can wait. This area should have benches, stalls, chairs separated by at least 1 meter distance. Respiratory waiting areas should have dedicated toilets and hand hygiene stations. Post clear signs informing patients of the location of respiratory waiting area. Provide paper tissue, alcohol-based hand rub and trash bin with leaf. Develop a process to reduce the amount of time patients are in the respiratory waiting area. Allocation of additional staff to the triage patients at high risk for the COVID-19. Setting of a notification system that allows the patients to wait in a personal vehicle and be notified by phone or other remote methods when it is their turn to be evaluated. In the triage process, assign dedicated clinical staff, physicians or nurses for physical evaluation of patients presenting with respiratory symptoms at triage. Staff should be trained on triage procedures, COVID-19 case definition and appropriate uses of PPE. Train administrative personnel working in the reception area how to perform hand hygiene and on how to advise the patients properly on the use of face mask, separation from other patients. In this standardized triage algorithm, which will guide how the healthcare facilities will manage with COVID-19 community transmission, like no or limited COVID-19 community transmission or widespread COVID-19 community transmission. This is the triage of patients with suspected COVID-19 infection, no or limited community transmission. First, identify signs and symptoms of respiratory infection. If fever more than 38 degrees centigrade or history of fever and at least one sign or symptom of respiratory disease. If no, then continue with usual triage assessment and care. If yes, place medical mask on patient. Then proceed for to identify travel and direct exposure history. Has the patient traveled or resided in another country where COVID-19 is spreading during the 14 days prior to the symptom onset? Or has the patient had contact with an individual with confirmed COVID-19 during the 14 days prior to symptom onset? If no, continue with usual triage assessment and care. If yes, separate from the rest of the patients. Place the patient in a single person room with door closed or in other designated area. Ensure healthcare personnel caring for the patient adhere to standard contact and droplet precautions. Only essential healthcare personnel with designated roles should enter the room and wear appropriate personal protective equipment. Inform the hospital infection control program and other appropriate staff. This slide explains the star mark I have mentioned in the previous slides. Single star denotes elderly people may not develop fever but new onset of cough or worsening respiratory symptoms. Double star denotes a contact is a person who is involved within 14 days after the onset of symptoms in the patient, providing direct care without using proper PPE, staying in the same close environment as a COVID-19 patient, traveling in close proximity in any kind of conveyance. This is the triage algorithm of patients with suspected COVID-19 infection for widespread community transmission. Same thing you'll have to do here. Identify signs and symptoms of respiratory infection, fever more than 38 degrees centigrade or history of fever. But in case of elderly people, they may not develop fever but new onset of cough or worsening respiratory symptoms and at least one sign or symptom of respiratory disease. If no, continue with usual triage assessment and care. If yes, place medical mask on patient, then proceed for to separate from the rest of the patient. Place the patient in a single person room with the door closed or in other designated area. Ensure healthcare personnel caring for the patient adhere to standard contact and droplet precautions. Only essential healthcare personnel with designated roles should enter the room and wear appropriate PPE. Inform the hospital infection control program and other appropriate staff. This is the triage process for the widespread community transmission. Follows appropriate triage algorithm. Give a face mask to the patients with respiratory symptoms. Immediately isolate and separate the patients at high risk for COVID-19. Limit the number of accompanying family members in the waiting area. Clean and disinfect the triage area at least twice a day with 0.5% chlorine or 70% alcohol. Triage ସମୟରେ healthcare workers ମାନେ କ'ଣ କରିବା ଉଚିତ? They will have to abide infection prevention and control precautions. In that, adhere to standard precautions like hand hygiene, selection of PPE, respiratory hygiene, cleaning and disinfection. Be trained and familiar with COVID-19 contact and droplet precautions. Ensure that environmental cleaning and disinfection procedures are followed consistently and correctly. Stay home if you develop fever or respiratory symptoms. Here, healthcare workers in triage area who are conducting preliminary screening do not require PPE if they don't have direct contact with the patient and maintain physical distance of at least 1 meter. Healthcare workers at the registration desk who are asking limited questions based on triage protocol that should have installation of physical barriers like glass or plastic screens. If the physical distance is not feasible, no physical barrier is there, then use mask and eye protection. Healthcare workers who come in contact with the suspected or confirmed COVID-19 patients at the time of conducting examinations of patients with respiratory system should wear appropriate PPE, including gown, gloves, medical mask, and eye protections in goggles or face shield. These are the important measures during periods of COVID-19 transmission. First of all, we'll have to develop strategies to avoid the overcrowding at triage and preserve PPE. To avoid overcrowding, non-urgent outpatient visits should be cancelled so that enough healthcare workers are available to COVID-19 patient care, postpone clinical elective procedures, and establish a respiratory evaluation center. It is an area near facility where patients with fever and respiratory symptoms can seek evaluation and care. Individuals with mild symptoms should be encouraged to self-isolate and only seek care if symptoms worsen. These are all about the triage of COVID-19 patient. An accurate triage decision helps the patients receive the emergency services in most appropriate time. Accuracy of triage is best indicator for quality emergency services. If you have any questions, please you drop in chat box. I will try my level best to clarify your doubt. To remain more updated, you may refer Center for Disease Control website and Ministry of Health and Family Welfare website also. Thank you all.